Welcome to our channel, HASHMICLINICS.
All right, welcome. Today we're going to dive deep into the fascinating world of a remedy that really lives and breathes in the damp and the cold. ARANEA diadema, the Popo cross spider. Let's get into its unique and really powerful clinical picture.
So here's how we're going to break this down. We're going to build the picture of this remedy step by step. We'll start with its absolute foundation, its constitution, and then work our way all the way through to the practical tips that'll help you use it with confidence in your practice. We have to begin with the absolute essence of ARANEA. You see, its entire picture is rooted in this powerful concept from Grauvogel, the hydrogenoid constitution. Honestly, this is the very foundation you have to understand to even think about prescribing it successfully. And this right here, this definition is probably the single most important concept for getting a grip on ARANEA. Think of it as the soil from which almost every other symptom grows. If your patient tells you they just can't handle dampness, ARANEA has to be on your list.
So this slide kind of boils down the core of ARANEA into 5 main pillars. You've got this clock-like periodicity, that extreme reaction to dampness, a really profound internal coldness, violent nerve pains, and this very, very peculiar sensation that parts of them are enlarged even when they're not. Get this core down, and you'll start recognizing ARANEA in the clinic.
Okay, so we have this deep-seated sensitivity to damp and cold. Now, let's take a look at how that actually shapes the patient's inner world and their general physical state.
You know, the mental state really just mirrors that pervasive damp and cold we've been talking about. You see this pattern of depression, being gloomy and irritable, and a lot of confusion. And notice that really peculiar modality. The confusion gets better from smoking out in the open air. That's a strange little clue. And that delusion of swelling, it's the mental confirmation of a physical sensation we just talked about.
This brings us to a huge general symptom, this bone-deep cold. Now, this is not a surface chill. It's a profound internal chilliness that just sticks around, even in warm weather, and piling on blankets doesn't touch it. When a patient looks you in the eye and says, "I feel cold to my very bones," your mind has to jump to ARANEA.
All right, now for the really interesting part. Let's zero in on those highly characteristic particular symptoms. You know, the strange, rare, and peculiars that make ARANEA just an unmistakable prescription when you find them.
I mean, this has to be one of the most bizarre symptoms in our entire Materia Medica. The patient feels this incredible sensation that parts of their body are just enormously enlarged, heavy and numb. This often happens right when they wake up, and here's the kicker. There's no visible swelling at all. And this is the perfect illustration of that delusion. It's a key confirmatory symptom. The patient wakes up from a deep sleep with this absolute conviction that their hands or their forearms are just huge and incredibly heavy. Wow. This is what we call a pathognomonic keynote of ARANEA. The timing is absolutely everything. The toothache doesn't just get worse at night, it's triggered the very moment the patient's head hits the pillow. It's an incredible and reliable symptom.
So the remedy has some clear favorite targets in the body. You see it acting on the nervous system with these violent periodic nerve pains. It has a strong affinity for the spleen, which often gets enlarged, especially after chronic or suppressed fevers, what we used to call malarial cachexia. We also see it in female cycles, with menses that are too early and too heavy, and a very characteristic pain right in the heel bone that actually gets better the more they move.
Okay, understanding the modalities, the things that make the patient feel better or worse, is just absolutely essential if you want to prescribe ARANEA with any kind of confidence.
And this periodicity isn't some vague thing. We're talking precise, predictable, clock-like regularity. The chill, the neuralgia, the colic, it all comes back, often at the exact same hour of the day.
This slide does a great job of summarizing the critical triggers and reliefs. The number one thing, the paramount modality, is the extreme aggravation from any kind of dampness. Damp weather, a damp house, even just living near a river can set them off. And you contrast that with this bizarre amelioration from smoking tobacco, but specifically in the open air. What a strange and valuable clue.
So putting it all together, these are the common clinical situations where ARANEA should be front and center in your mind. You've got to look for it in cases with a malarial history, those intermittent fevers, the clockwork neuralgias, and especially that kind of heel pain you see with a calcaneal spur. All, of course, within that hydrojoint constitutional picture.
All right, let's take a second to differentiate ARANEA from some other remedies that share these core themes of periodicity and damp aggravation. This is where clinical precision really comes into play.
This table gives us a really clear side-by-side. I think the biggest point of confusion is often with Cedrin because of that clock-like periodicity. But just remember this. Cedrin is for hot climates, ARANEA is for cold, damp ones. Simple. With natrum sulf, another great hydrogenoid remedy, you gotta look for the characteristic gut symptoms. And while Rustox is also terrible in the damp, it has that classic rusty gate stiffness that gets better once they get moving, which ARANEA just doesn't have.
Finally, let's just distill all of this information down into a few memorable pearls that you can take with you and use directly in your clinical practice.
Here's a great little memory tool, the hydrogenoid trio. For any case that's dominated by damp, weather aggravation, think of these three. If the patient has that deep internal coldness to the bones, think ARANEA. If their problem started after getting chilled while they were hot and sweaty, think dulcamara. And if there's that marked restlessness and stiffness that's better for motion, you're thinking Rustox. Look, if you remember absolutely nothing else from this deep dive, just commit these 5 unforgettable keynotes to memory. They are the absolute heart of the ARANEA picture, and they will guide you to a successful prescription over and over again.
And this is a hugely important clinical tip. Always ask about the patient's history. If you find out that their chronic complaints, especially something like neuralgia or an enlarged spleen, kicked off right after they used quinine to suppress malarial fevers, ARANEA needs to be at the very top of your list.
So I'll just leave you with this question to mull over. Think back on your cases. Was there ever a chilly, damp-sensitive patient with those periodic complaints where another remedy just didn't quite hit the mark? Maybe it was ARANEA, just waiting to be discovered. I really encourage you to integrate this valuable remedy into your clinical toolkit.
Professor Dr. Rifat Hashmi is a distinguished homeopathic physician, educator, and researcher with over 4 decades of clinical and teaching experience. He is widely respected for his deep command of materia medica, repertory, and constitutional prescribing, combined with a practical, patient-centered approach. Dr. Hashmi has dedicated his career to training generations of homeopathic doctors, blending classical principles with modern clinical insight. He is also known for his innovative work in digital homeopathy, developing educational content, clinical tools, and AI-assisted systems to enhance remedy selection and case analysis. With a strong commitment to ethical practice and lifelong learning, Professor Dr. Rifat Hashmi continues to guide, inspire, and elevate the standards of homeopathic education and patient care.